Hello, my name is Vivian Hunt, and I'm one of the co-authors of this paper, Healthcare Costs Matter, a review of nutrition economics. This study was initiated in 2014 when Abbott Nutrition commissioned a postdoc student at the University of Illinois to conduct a review of studies that demonstrated a link between nutritional support and health economic outcomes. Our aim was to assess the scientific evidence that demonstrates the role a nutritional intervention can play in managing healthcare costs. And we wanted to look at the range of studies and methods being used to quantitatively measure the economic benefits of such interventions. In other words, we wanted to evaluate the growing body of research at the intersection of health economics and nutrition. Our search criteria included nutritional interventions linked to an economic assessment. We included original research with no restrictions on the clinical study, design, setting, duration, or nutritional intervention type. Figure 1 shows the range of economic methods being used to assess these interventions. It includes ICES, Markov, Monte Carlo models, as well as cost utility, budget impact, and more. Of the first round search of 5,646 publications, we found 274 met the study criteria. The most common setting for the studies was the hospital. And 40% of all interventions provided nutritional supplementation or changed dietary practice. 12% were oral nutritional supplementation, 11% parenteral nutrition, 9% special diets, and 7% enteral nutrition. Outcome measures included medical care costs, hospital length of stay, readmission rates, and mortality. So why is this review important? There's a growing body of research that demonstrates the prevalence of malnutrition in hospital ranging from 20 to 50%. This is happening across the world, and the data suggests that a patient's nutritional status can often worsen during the hospital stay, especially among the elderly. The negative outcomes of malnutrition are many. They include increased frailty, increased risk of fracture, suppressed immunity, and a far greater risk of admission to hospital in an emergency. All of these add substantial cost to the healthcare system. The review found that the majority of the studies were from Europe, 39%, 28% from the US and Canada, and just 9% of studies were from Asia. This is a research gap. And as Asia now accounts for 56% of the global population, more research should be undertaken in this part of the world to understand how healthcare systems are being impacted by rapidly changing demographics. This includes aging and growing levels of non-communicable disease, which is being impacted by changing lifestyle patterns in this part of the world. The review found a variety of health conditions in the studies, with malnutrition and surgery accounting for almost a third. Health outcomes measured with mortality rates, quality of life, and economic outcomes measured includes cost, length of stay, savings, and cost effectiveness. There are a number of retrospective analyses together with RCTs demonstrating that oral nutritional supplementation is cost-effective in both community and hospital settings. The cost savings related to improvement in the nutritional status of the patient outpaces the relatively small cost of the oral nutritional supplementation intervention. So a key conclusion from our review is that nutrition economics is a new field, but that the number of published studies seems to have increased at least fivefold over the 10 years to 2014. There is growing evidence that a nutrition intervention can improve health and reduce medical care costs. We believe that policies to incentivize screening, assessment, and the treatment of malnutrition will be more important in the future. Future research should focus on Asia and elderly populations. As the corresponding author for this paper, if you have any questions, please do not hesitate to email them to me. Thank you for your time.